Frank Binational, and I'm a community family physician, and it's my pleasure today to introduce Dr. Carlos Cabrera from Merida, Yucatan. Dr. Cabrera was named Physician of the Year when he did his year of service in his local village, and he has since established through Brazos Abiertos Open Arms a peer-on-peer educational program called TEAM, T-E-A-M-M, which stands for Teenage Education on AIDS in Merida, Mexico. U.S. high school and college students facilitated HIV/AIDS workshops in the villages and then returned to Mexico again to train local teenagers to teach the workshops themselves. And as part of Binational Health Week, Dr. Cabrera is here to talk more about his work today. Please welcome him.
Thank you, everybody. I'm so happy to see these results of, for this meeting. I want to thank the Center of Excellence on Health Disparities for the opportunity to be here today to speak with you about the work we do primarily in the Yucatan and the rural communities there. I want also to talk about potential partnership with UC Merced in regards to internships and volunteer work with our organization, and also about some strategies when we want to target migrant workers who return to the Yucatan. So the topic of my talk is HIV education and prevention as a binational effort. First, I want to mention about how did it start with an initiative from Merced Sun-Star Inc., a U.S. 501c3 nonprofit organization, and our work nowadays is carried out through Fundación BAI-AC, which is our Mexican nonprofit corporation. Our mission is to empower the people of the Yucatan to respond to HIV/AIDS. This is one picture testing a Mayan lady for the first time in a Mayan community, rural community in the Yucatan. That was in 2008. Our vision is to be the catalyst where knowledge, prevention, and treatment of HIV/AIDS replace fear, discrimination, prejudice, and death of those people who are already infected. Our goals are to decrease the spread of HIV and sexually transmitted diseases in the Yucatan and improve the access to the healthcare and improve also the overall quality of life for those people who are living with HIV/AIDS. Brazos Abiertos was the first nonprofit who started conducting a peer-to-peer education program about HIV, STDs, safe sex, and teen pregnancy workshops in the Mayan villages. In the US, it's very common to see all these peer-to-peer education programs. And when Brazos Abiertos started, it was our Team USA group of people who were college students back then who came to the Yucatan with a peer-to-peer model and started applying it on the Mayan communities, specifically two communities on the northern of Merida, which is the capital city of Mexico, of the Yucatan. And they started empowering their peers to be able to multiply the efforts with the local peers in the future, which they already started doing as of 2009. Here we can see some pictures of some workshops that were carried out in other Mayan communities since 2009. We also distribute free condoms anonymously. One of these pictures was taken in Mexico City in 2008 at the World AIDS Conference, for the first time held in a Latin American country in Mexico City. One of the dynamics that we use is to kind of make sure that the local people don't fear the use of the condom. We teach them that the condoms are their friends. In Mexico, there is a huge taboo associated with a condom. The macho culture does not contribute to, increase the access to condoms, and people don't really seek for them, or they rather not use it. We also offer free anonymous HIV testing. One of these pictures was also the first HIV testing campaign that was carried out in the island of Isla Mujeres, Mexico, that is right outside of Cancun in the Yucatan Peninsula. It's a small island with 15,000 local people, and we were the first who started doing this outreach testing there. As you can see also in one of these people, there is this young man from Chiapas that is selling gum, cigarettes, everything he can do to make a living in the main square of Merida. And the Chiapas people are actually working in those squares in Merida. One of our programs carried out that night actually detected one of these men as positive. Brazos Abiertos provides pre and post HIV test counseling. Our program is also divided into 3 moments every time we do the campaigns, and one of them is the pre-counseling. Even though some people leave the program because they are, on their way to work, or the bus is going to be, the last bus is at 10 or 12 and they have to leave to go back home, they learn from the pre-counseling, specifically on how HIV is transmitted and how it can be prevented. We also offer free medical monitoring to our HIV positive clients. I am the physician of Brazos Abiertos, and every time I test a positive case, I usually refer them to the local HIV treatment facilities in Merida, and also every month monitor their state of health to make sure they are adherent and compliant with the antiretroviral treatment. Brazos Abiertos also, as of this year, started offering psychotherapy sessions. We offer volunteer work and internships for students from all over the world who are interested in health and social related sciences. Here we see how Brazos Abiertos started with our first Team USA volunteers, other people who came from all over the world, but in particular from the US. These 2 pictures to the left are from our latest interns. One graduated in PH from UCLA, who came to do a summer internship with us, 400 hours, 2 months and a half, so she was full-time with us. And the cultural experiences that, an exchange that all the local peers in the US volunteers experience is just amazing and unique. We help middle school and high school students and adults through our education program. Brazos Abiertos targets local population and high-risk groups throughout our HIV testing program. We implement HIV and safe-sex education curriculums in middle schools and high schools throughout the Yucatan Peninsula. This was at the beginning quite of a challenge because sexual education in the Yucatan and in general in Mexico has faced a lot of stigma and in general challenges by the Catholic Church. There are states in Mexico that have forbidden the use of explicit images and content in their official books for elementary school students when it comes to biology and then the sexual anatomical parts. They don't want it to be there displayed. So, in terms of trying to be, according to these regulations, but also making sure that the students have access to an appropriate anatomy training, on this aspect is very important for us. And we have developed an anatomy and HIV/STD successful curriculum in some of these middle schools. We counsel HIV positive people, channeling them to the local HIV treatment facilities. Here is one of the other testing campaigns we carried out in Merida in one of those main squares. And it's an interesting picture because here am I giving the result to a positive person in front of the Catholic Church. And we continue to monitor their state of health. This was actually at the main square in Merida, 22-year-old male who only had one unprotected practice. It was actually his first sexual intercourse, and he was positive after he was tested. He was that one where he got infected. We also help local universities and organizations to become more aware of the HIV issues facing the citizens of the Yucatan Peninsula. Our board president, Dr. Gordon Crawford, is a world-recognized HIV specialist, still practicing medicine and HIV medicine in Houston, Texas, and he comes to the universities in Merida to speak with the medical students and health-related students who are very interested in knowing more about HIV/AIDS. As part of our background and our curriculum in medical schools, we're only trained about the physiopathology aspects of the disease and that it is an infectious disease, but that's it. We don't know really from a formal training further about this disease. So it is important that we continue to educate people who are in the related sciences so they can spread out the word and also apply it to their own practice. Even though Brazos Abiertos is a young organization, we have been able to target many different audiences and build relationships with a number of people and organizations. Their very generous gifts have enabled us to continue and grow our testing, education, and prevention programs. Since our founding in 2007, we have conducted and/or participated in around 50 events, whether they were peer-to-peer workshops, community fairs, health fairs, conferences, and testing campaigns. We have tested over 2,000 people since year 2008. We have counseled over 3,000 people since the same year. We have channeled over 30 people to the local treatment facilities. We monitor and follow up currently 40 HIV clients that are receiving their ARV treatment and whose viral loads are undetectable. Actually, as of yesterday, we're following up 3 more, so it's 43. I gave 2 positive results yesterday. One of them was a 24-year-old medical student. We have participated in the Global Village and attended the 12th World AIDS Conference in Mexico City in the year 2015. We have distributed over 30,000 condoms throughout the Yucatan Peninsula, that is 3 states. We have recruited over 100 volunteers in the Yucatan and abroad. We have established since this year, as I was telling you all, a psychotherapy program and established communication bridges for coordination with and mutual support among other nonprofits, the media, and the government agencies. What does our TEAM program mean? As Dr. Frank was telling you earlier, TEAM stands for Teenage Education About AIDS in Merida, Mexico. The program started with U.S. students, we call them Team USA, who facilitated workshops in middle schools in the rural communities. The primary assistance that they were provided in the medical area started with Dr. Gordon Crow. Team USA then trained local youth to become workshop trainers themselves, and they empowered their local peers to be able to do the same in future workshops and interventions, which they already started doing. Team USA returned a few more times to train Team Yucatan in different models to improve this communication. And since 2009, Team Yucatan has conducted several workshops and fairs in different communities of the Yucatan. They are now empowering their own peers to respond to HIV/AIDS. And when we talk about the fact that in the Yucatan there are no peer-to-peer education programs, this is a huge impact to the community. About Brazos Abiertos internship program. This is the part where I would really like to tell you more about that, because you could be future potential interns to our organization in Mexico. Since 2009, Brazos Abiertos has accepted 16 volunteers from different U.S. universities. 10 have been formal internships. 2 were just finished recently after the summer. 7 interns were fluent in Spanish. They have experienced cultural exchange and learned from their local peers. They improved their Spanish language skills and how to better communicate with the local population. This is really interesting. When Team USA came for the first time to the local villages, most of them didn't speak Spanish, and they were communicating with their peers with visual signs, with some translation, and the assistance of a few translators. But it was a very interesting way on the way that they communicated with the people, local people, and they succeeded in doing that. And they were very well received and welcomed by the local population. They have put in practice their cultural sensitivity and professional background. And being fluent in Spanish is not really required to be part of a program, although it is desired. But the experience in the past with the other interns only show that you can improve your language skills if you're there talking to the people, if you're there willing to communicate the message in a proper way, and if you're there willing to make a difference with this needed population. As for the cultural sensitivity, it is important to stress this out, because I was actually meeting with some of you earlier today, and I received, I was asked this question about what does cultural sensitivity meant in terms of our program. And it's basically more just to be humble enough to be able to accept other people's decisions in terms of how do they want to approach this information in their own culture and in their own community with your help. So cultural sensitivity is focused on mainly adapting to the new place you're arriving. As you have your own particular needs, the local people do have their own needs, and when you partner with them, like our past villages have, we just see an amazing and unique involvement and way of replicating the efforts in their benefit. The internship opportunities that we're currently offering are in two categories, and they relate to each other. The first one is in the research field. Interns in this category facilitate data entry and data analysis. This year, actually, we started doing our data entry, and we're projecting some results perhaps by early in the spring next year, and about everything that we have done so far in the past 3 years, and that will show on a hopefully validated study all the efforts that we have implemented. Just briefly, I want to comment to you some of the results of our surveys in the Mayan communities. Teenage girls have responded to, one of the questions is that if they are still virgins, and most of them have responded that yes, they are virgins, but they have had anal sex. Because losing a virginity is still considered just having vaginal sex, but they're still being virgins. Also, they think that by taking contraceptive pills, they can prevent HIV/AIDS. Another dramatic result of our surveys is that they're having a lot of anal sex, and we're talking about young girls. The interns also redesigned some of the outdated survey materials and improve upon survey methodology. They maintain the database and catalog research materials. Also provide support in the organization and administration of monthly or bi-monthly HIV detection events, and provide health education program support. They're also required to attend, our testings, every time we have it, because they're the ones in charge of collecting this data. As for the health education and rapid detections positions, these people are in charge of organizing and facilitating HIV/AIDS education workshops in Merida and surrounding villages. They manage Team Yucatan, which is our student peer-to-peer education program. They develop and lead bi-monthly meetings for team. This, has a very important component in terms of making sure that these students improve their public speaking skills, the classroom management skills, their leadership skills, and the health education knowledge. Most of these young kids in these Mayan villages have amazing skills and talents, and their capacity is really not put to the test yet because they are not offered the opportunity. Some of our interns started these, training and workshops on their leadership, skills and communication skills, and we had very shy Team Yucatan members at the beginning who are now giving these talks, maybe better than I am right now. So it's really interesting to see the difference between then and now. They are also required to maintain and catalog education program materials and provide research program support, and also assist in our testing events. Now, talking a little bit about statistics in the Yucatan. Now we're moving forward to talk, what was the pertinence of starting this program in the Yucatan? The Yucatan Peninsula in Mexico is divided into 3 states: Yucatan, Campeche, and Quintana Roo. Up to December 2010, the national ranks and accumulated incidence per capita, that is 100,000 inhabitants, and among 32 states, where the Yucatan was number 7, Campeche number 8, Quintana Roo number 9. That is the entire peninsula in the top 10, and that's the accumulated incidence per capita. And we're talking also about the fact that the Yucatan state has 2 million inhabitants, which is basically not that many people. HIV/AIDS in the Yucatan also reports the following cases in 2010: HIV and AIDS. There were 151 reported HIV infections. There were 164 AIDS cases, and basically the government numbers were 315. But we estimate that there is almost half of that total, in not being reported data. As of the 36th epidemiology week in 2011, we see that there are 181 cases of HIV, and comparing that to the same week in 2010, we see that it's almost double. And there are 44 cases of AIDS so far. So there was not available data at that time for the same week last year. But we're seeing an increase this year. The age and the gender distribution of the accumulated cases since 1982 up to 2010 are as follows. Basically, the concentration of cases, it is on the young population, people between the ages of 15 to 44 years old, and also men are the ones who are being affected. The new and accumulated cases of HIV/AIDS by category of transmission and the gender distribution. In this chart, we can see that sexual transmission is still the #1 way of spread of the disease in the Yucatan. Just in 2010, we saw the 174 reported cases due to this cause, and the accumulated cases were 3,949. When we talk about women, there were only 795 cases in this whole 2 decades. But the newly infected cases that are being reported on women represented 21% of the total infections as of the past 2 years. IV drug use in the Yucatan, if you see this chart, you can tell that IV drug use is not a real problem in the Yucatan. However, when we speak about the migration component of HIV/AIDS, we see that those Yucatecan migrants that are coming to the U.S. who face different challenges when they come here go actually to drug abuse. I mean, they actually, don't have friends, they don't speak the language, they're in the shadows. So basically, they start their drugs, they get infected with hepatitis C, B, HIV, come back to the Mayan communities and infect their wives. Vertical transmission has also been a component of the transmission, but not very significant. There has been a lot of education on this to the pregnant women, so they avoid the vertical transmission with breastfeeding. This is very important too, the associated mortality with HIV. The mortality rate for the general population as of 2010 was of 5.65%. And the mortality rate for the group between 15 and 44 years old was of 12.52%. That's a huge mortality rate. AIDS is the #12 cause of death among men in the Mexican population, and this is country-wise. AIDS is the #19 cause of death among women in the Mexican population, and the #14 cause of death when we refer to both. Here is the graphic of how the mortality has evolved through the years, and here is since 1997. We observed different peaks, but last year was actually a very interesting peak here, 12.52% on the 15 to 44-year-old group. Now, when we move to talk about the migrants, the Yucatan is one of the most active regions in Mexico, sending migrant workers to the United States and also to other states in Mexico. Recent statistics indicate that 220,604 migrants have been identified among 101 county seats in the state of Yucatan. This represents 29% of the total population of the state, which means there are towns in the Yucatan that only have women as citizens. 21.2% are international migrants and 32.4% are national migrants. The most common places where they migrate is, the touristic poles, which is, for example, Cancun, that is more or less 4 hours away from Merida. And the Mayan villages are closer to Cancun, actually, and they're hired as masons, sometimes 3 weeks, sometimes 1 month. Also there, they have sex, unprotected sex with prostitutes. They come back to their Mayan villages. The wives ask them to use a condom, and then they refuse. The excuse they give is maybe the wife is cheating on them, but I guess it was the opposite. Male migrants are being infected in a higher percentage than female migrants. Women are infected by their migrant husbands refusing to use them. The challenges that I think are very important to stress here is I mean, I think a lot of people perhaps Mercedes has a lot of underserved populations, not only the Latinos but also other migrants. And I think it's very important that at least you are studying in the university, and I think we can replicate this information around, and to know that the taboos associated with the condom are one of the biggest challenges. How do we tell these people that the condoms need to be used to protect themselves? How do we tell them? The American population welcomes the condoms. We were talking earlier about how, in the early 80s and 90s, people were using condoms a lot in the American population. And yet in Mexico, because of the macho culture, people don't use them. The cultural barriers are also a problem here. The stigma and discrimination and the prejudice also and the death associated with the disease is a big problem. People don't really want to be tested because if they face a positive result, they think they're going to be rejected and banned from the society. They think they're going to be kicked out of their jobs. And that's being sometimes realistic. Some people do that. They rather stay without being tested for HIV and die of AIDS at some point. Sometimes I've counseled people and they tell me, I'm going to die of something, so it doesn't matter if I die of AIDS and I get the results when I'm about to die. And that's the mentality of the Yucatecans. The social barriers, such as the poverty, the ignorance, and employment, that's also an important factor that adds to the risk factors for getting HIV/AIDS. The language barrier, migrant workers come here and they don't speak the language. They get these jobs in some places where they need them, but they don't really know how to communicate with their employers. They do what they can. They have also limitations to the medical services. There are programs now that are aiding them and assisting them, but sometimes they don't know where they are. So it's important that we channel them to the proper facility places. The legal barriers, as you know, there are a lot of illegal migrants crossing the border, and they are afraid to ask for health care because they think they will get deported. One of the important factors also on the challenges is that the migrants are moving constantly. They move from city to city and then from state to state, and they don't have a record where we could keep track of what is happening with them. And the depression and the associated drug abuse. This is where the strategy of designing a tool such as the national health cards for each age group and gender would help monitor and keep track of the information on the underserved population. We're talking more of the Hispanic population here because these are the ones who return to the Yucatan in particular and are infected of HIV. The Mexican government has this policy of providing a health card to each group. When you're born, you have your card, and then the doctors should record your vaccines, and they should record your diseases, and they should record everything that doctors do every time you go to a consultation. And actually, they are focused on a lot of prevention strategies. As we can see, there is one for children from the age of 0 to 9 years old. There is one for teenagers from the age of 10 and 19 years old. This created a huge debate nationwide 2 years ago when this was approved, this teenager one, because there were conservative parts of the society and the politicians who didn't want this to come up because there was a part about HIV, AIDS, and other sexually transmitted diseases, and they were opposed that this population was tested. Finally, it came through, and they have the right, to be tested at the age of being a teenager. Also for men between the age of 20 and 59 years old, there have been identified special needs for this population, as well as for women on the age of 20 and 59 years old, and specific prevention strategies such as the pap smears and the mastographies and all kinds of tests related to the age and the chronic diagnosis that women and men experience when they're in this age. And also for the elder adults, older or above 60 years old. Mainly this is also focusing on vaccination for the pneumococcal and for the pneumonia and for the flu. It is really important also to talk about the human side of treating HIV/AIDS. Physicians should be compassionate of the people who live with HIV/AIDS. We're seeing more discrimination within the physician community in Mexico and in the Yucatan. If you're a physician that treats HIV/AIDS and you tell another physician that you're doing that, they laugh at you and they really ask you, seriously, what are you working at? And this is really important because they don't want to touch HIV patients. They don't want to explore them. They don't want to have anything to do with them. And they refer them to the infectious disease doctors in the Yucatan. And in fact, the number of infectious disease physicians in the Yucatan is 7. Identifying and treating STIs, infections, and opportunities infections are key factors to improve the health status of these people. And this is again, when they are in the consultation room, physicians don't really care to explore them, and sometimes the patients refer, they have some symptoms or they have some signs in their genital areas or in their bodies that these physicians that are seeing them avoid from the exploration or refuse to touch. So that means that opportunistic infections are still killing people of AIDS. Also, stressing the point about improving the good physician-patient relationship. This has been lost in many countries, especially due to the business and legal aspects of practicing medicine. We have to go back to the essentials of medicine, and that is to develop a real and authentic doctor-patient relationship. When you develop this relationship, you can actually make sure that the treatment you're providing to your patient will succeed. You can make sure that you give a proper follow-up. You can make sure that the referrals are on time and proper, and you can make sure that that other person is being treated when you refer them to a specialist. This is very important because most of the physicians don't keep track of the referrals and counter referrals that they get. They don't really know if the psychology department is treating them. They don't really know if the psychiatrics department is treating them or the dermatologist. They just send them. So coordination among the 3 levels of health treatment is really important. The patient should be treated as human beings, not as diseases, not as numbers, not as statistics. When we are in hospitals and medical students are often seeing these patients, actually when they're in a terminal stage of AIDS, they see them recluded into what we call, the restricted areas. And the restricted areas, well, people are dying. There are people dying there, and we tell just, number 2, number 25, the guy with AIDS, and it's the health staff who is referring to these people like that. Acting with cultural sensitivity and being empathic with the patients can dramatically change the turnout of the treatment. Coordinating the efforts with other departments such as psychology, odontology, dental, social work, and the support groups contribute to an integral treatment of these infections. As of this year, we started actually having, as I was telling you, these psychotherapy groups, and we have now 7 people with the ones that were positive yesterday, and we will start creating a support group soon, and we will become the second nonprofit in the whole Yucatan that will be offering the support groups. This is going to be a huge change for the treatment with these patients. Continuous counseling about adherence and compliance to the antiretroviral medication is required to assure the success of the treatment. This is one of the services that we also offer to our patients. When I monitor their status every month, I make sure they're taking their drugs. I make sure they're not losing any doses. I make sure that they're actually undetectable. They have to give me their viral load status, their T-cell count, and associated data that will help me determine if they're really complying with the treatment. All of these considerations are strongly recommended for physicians to apply, not only when dealing with HIV/AIDS, but also with other serious diagnoses. And actually, in general, we're talking about a human being that even if he has the flu, it is important that he's treated as a human, not as a disease. Some stories behind our work. Why did Brazos Abiertos start? Well, in 2007, Dr. Gordon Crawford from Houston, he formed Brazos Abiertos Inc. there in Houston with a group of expats and Mexican nationals. Expatriates are basically those people who retired from the United States and are moving to cities in Mexico or other countries. And Merida has a huge population of expatriate people. We have 5,000 Americans and 6,000 Canadians. right now. So there were key and important components of the start of this organization. Dr. Crawford has been a leader in HIV education and medical research since the 80s. He still practices medicine and sees 1,500 HIV positive patients in Houston. Domestic violence and sexual abuse are a common denominator in the rural villages and poor neighborhoods in the Yucatan. Sometimes when we counsel people, and they're women, and we ask them to tell us about if they have ever been beaten by their husbands, they're very careful to answer that because they don't want to be beaten by their husbands if they find out. And it's really important to say that they're hiding, that information from many people and for years. That also contributes to the spread of HIV. Over the past decade, hundreds of infected people have been refused medical care in local hospitals and suffer severe discrimination. There has been a change since the past decade, in the 2000 to 2010. In the early years of the 2000 decade, there was only one bed at the charity hospital that said SIDA at the top. SIDA means AIDS. And that meant that those people who were coming to die to the charity hospitals had to be in that bed. That meant that if there were other people of AIDS dying, they could die in the street. 21% of the newly infected cases are women. That is in the past, 2-3 years, new infections. Not in the past 20 years, but the new infections. Also, other of the comments that I was talking earlier to some people here was that the fact that families started to discriminate their own family relatives who were diagnosed with HIV/AIDS. There were dramatic testimonials from people living in a shelter, in an AIDS shelter, that told us that their families sent them to the pig pens and were fed just once a day and treated like animals. The AIDS shelter volunteers had to rescue them from there. And those traumatic stories just motivated us to act, to be proactive about these people, because they're human beings and they deserve to be treated with respect like anybody else. In 2007, the local charity hospital, had this SIDA word at the bed. Men who have sex with men often are stigmatized and discriminated against in all social levels. There are more MSM people in the Yucatan. Actually, Merida has a high population of these people, and they're mobilizing, in order to gain more strength and power in the society. However, doctors are still discriminating them, refusing them medical service. The government agencies also deny them their rights. New job applicants are frequently pressured to be tested for HIV, and this violates completely the law. They trick them. They tell them, well, if you want this position, you have to be tested for this, and if you want, because otherwise somebody else is going for the job and will be willing to be tested. Health professionals often discourage women from their right to be mothers simply because they're HIV positive. Now we know that women infected with HIV can have babies and can have negative babies. That means that if they are treated properly, if they are monitored properly, and if they know the information properly, they can be mothers, and they can be mothers of negative babies. This is very, very common in the Yucatan. Physicians are telling everybody, no, you cannot be a mother, you won't be a mother, and we have to tell them you're wrong. And then this becomes an argument within the physician community. What has been the impact of our work? After our first late-night testing campaign in the main square in Merida, we found 5 positive cases out of 50 people being tested. That means a high incidence rate. It was 10%. These positives were young people between the age of 15 to 25 years old, and say that they would have never considered being tested because they didn't think they were at risk. If just one of these people infected 3 people in 1 year, and those 3 infected 3 people, infected 3 more, and so on, the number of potential new HIV positive people could be equal to 500 in 3 years. That means that those 5 people that we tested could have been a potential transmission for 1,500 new cases. And that means that with education, proper detection, and prevention, we can save the system thousands of dollars. We can save the system new infections, and we're contributing to decrease this public health important disease. in the community. Oh, this is Dr. Frank testing in Tikul this year. There we see him in the village of Tikul with our 2 interns in the summer. We are using a 1-minute rapid HIV testing. It's a Canadian technology. It was just approved this year by the FDA in the United States. And the picture below, it is World AIDS Day in the Yucatan in Merida last year, 2010. For the first time, they brought like 10 different schools, middle schools and high schools from all over the city to attend this event, and we were the booth that was more demanded for our HIV rapid testing services. Thanks to Brazos Abierto's counseling and follow-up, several suicide attempts have been prevented and stopped. Our Team Yucatan volunteers and people who have attended our workshops have experienced a personal change in their understanding of HIV/AIDS and other STDs, and are also educating their peers in their local villages. Humanism, compassion, and trust are important factors that our clients appreciate. These are also some of the pictures of our campaign in other Mayan villages. We see one that was right in one small park in the city, and we also had participation of the people who are walking by. As I was explaining, we just invite the people who are passing by the main square. We ask them to fill out their consent form. We tell them it's going to be 10 minutes. The talk is 10 minutes, and then we do the test. The total time that the process takes is from 30 to 40 minutes per person. And if we do it on a group, we make sure that more people are receiving information. According to our Mayan youth, typical problems such as alcoholism, drug abuse, STDs, teen pregnancies, among others, have been prevented by attending our weekly meetings at the village. We also provide our free services to the expat community in the Yucatan. We have also detected some of the expatriates, members of the community, with HIV/AIDS and are receiving free antiretroviral treatment in the Mexican system. This was our latest campaign in the island of Isla Mujeres, Mexico, just right outside of Cancun, as I was saying. And this was the building of the Red Cross, the one we were right there in their garage. And it's interesting to see the difference between the Red Cross's facilities in the US and Mexico, right? In 2009, we began for the first time a rapid HIV testing campaign education program internship in coordination with the local groups of Isla Mujeres. So this was the 3rd year. We provide cultural and enriching experiences for our volunteers from other parts of the world. This is one of the most important benefits that I can tell you the interns have when they go back home. We offer audiovisual resources such as the award-winning computer game, Dios Verde, that was made and designed in collaboration with Purdue University. The people from Purdue came to Merida and to the rural communities of the Yucatan to take notes, observe the cultural patterns, the differences, what they wanted to hear about HIV, how do they want the information to be reached out to them, and they designed this game. It's in Spanish, and they were sending all these prototypes to the Mayan kids about what was going to be the name of the warrior, what color they preferred, and they named it Dios Verde, which means the green god. And that won the award for the best project of the School of Technology at Purdue. This was the poster of the protocol that was also presented at a conference in Japan in year 2009. And I have a video here that explains a little more about the game. I don't know if it's gonna play. Well, I can show you the video separately later. Finally, the binational statement is all of the efforts described previously are clear evidence of the success of this binational initiative and all these binational efforts. Both U.S. and local board members of the organization, benefactors and volunteers involved in our programs reflect a high level of satisfaction with the cultural exchange experiences where everybody learns from each other. with binational efforts like these, many other programs, not only oriented to HIV/AIDS, but any other serious diseases or any other cause, are more likely to succeed. We would like to invite you all to become part of our Process of Virtus program. And thank you. If you have any questions, I will be very happy to answer them. Maybe I can. That video won't play. But any questions? Yes?
So I've never actually encountered a doctor who actually was dealing with a woman who might be in a situation where she knew her husband was positive. Do physicians actually consider prescribing tenofovir to the wife now that clinical trials have shown that that's a good way to prevent HIV transmission, even though it's not really FDA approved for that purpose?
Oh, correct. And also, well, that should be the model to follow. But no, we're not doing that in the Yucatan on a routine basis. Tenofovir is only used to prevent, potential transmission with the workers in the health areas. For instance, if a nurse or a doctor pricks, the finger with an infected needle, then they would put him on tenofovir.
But not with, if a woman says she knows her husband's positive and he won't protect her.
Mm-hmm. They won't. Because also we're facing lack of medication in the stocks for that purpose, for the prevention aspect. There's only medication to treat those confirmed cases.
Oh.
So we have to work around that aspect with them counseling both, whether to have abstinence while the window period is taking place, test her to make sure she's not infected, and make sure, it's the only way to continue being negative is to have protected sex. Yeah, but sadly we're not doing that. Yes?
If I wanted to apply for nutrition through the summer, what would I apply?
You can go to hivyucatan.org. I'm going to put here the website. And go to the contact us form and just fill that out. And you will be able to contact us.
Thank you.
hivyucatan.org. Yes?
How would you apply some of the lessons you learned from the project to address a similar project in the United States?
Can you say that again louder?
How would you apply some of the lessons you've learned from the project to address a similar project in the United States?
Well, particularly with the cultural sensitivity aspects of it, well, in the U.S., peer-to-peer education programs have been proven to be tremendously successful. So if you apply the same model of the outreach education component to the unserved populations, for instance, making sure that you follow their beliefs. Like every culture has their own beliefs in something. So if you approach them with their own cultural beliefs, I think these projects in the U.S. will be more likely to succeed too. Yes?
Because you know how AIDS is very different between patients, and the exact makeup of it isn't always the same. Could you talk about the availability of the spectrum of treatment for the patients you are treating? Are they able to receive the full spectrum of antiretrovirals as they progress as AIDS progresses?
Yeah, that's a good question. In Mexico, we don't have all the availability in the medication arsenal that is available in the U.S. We're getting more every year since 2008. But the ideal thing is that when a patient is diagnosed with HIV, regardless of the viral load and the T cell count, they should be put in treatment. The multicentrical studies have shown that has the best effect in the long term, because eventually we'll have to put them on something, and usually they are cocktails. We do have them. We do have different categories or families of medications, and we usually put them on those. We tell them that they need to be adherent and compliant to the treatment in order to avoid to develop resistance to the treatment, because we have a limited number of medications that can be considered as rescue medications in the event they develop that resistance. So they really need to be careful of not missing any doses, of making sure they take it, of making sure they report the side effects to the physician that's treating them, so they can make a proper change or switch to another medication that can be better tolerated. But yes, we do tell them that. Thank you.
Do you
Yes.
think there are any drawbacks to the national health card being such a wide age gap for the 10 to 19 and then there's 20 to 60 or 20 to 50? Do you think that there could be drawbacks within that because certain ages have different values and how you can talk to somebody who's a teenager as opposed to somebody who's 10 years old?
Absolutely. I think that's a great idea. Well, those are the ones who the federal government have, identified and actually, made. And, the health system in Mexico is public, like many European countries too. And the system has been there for many, many years. So they developed these, vaccination or health cards. But I think that the idea that I would really like to start developing with you, Merced, and some of the people who are involved in the community here, and I would really love for you, if you're interested, to contact Marilyn, Michelle, or the people in the university who can tell you more about it, to design your own cards, because that's the idea, to design a card for the population who are returning back to the Yucatan or returning back to other places. But you know that the Mexicans are strong, and a high population here in California that are going back to Mexico. And if we make sure that we design these cards, they can be simple, 2 pages, 3 pages. That national card in Mexico for each group is like 6 pages. It's like a book, like a passport. And then there's also discussion because they don't take it to their physician consultation every time. And mainly the nurse is the one handling it because the doctor is busy seeing the patient. The nurse cares more about the filling and follow-up of the cards. So if we design together one system where we can provide a small card to the people that are going back home, we can make sure that when they come to the Yucatan, I see that infected, I see what they did in the U.S. inter-benefit, and I can continue their antiretroviral treatment with the same medication, so I don't develop resistance putting them on new drugs. So that's a great idea. Thank you. Any other questions? Yes.
Yeah, did you experience any kind of community resistance when you guys are going to these small communities to test them?
Yes, I was telling some people earlier today that we were in Maya Village one day and we were testing right after people was coming out of mass. And then those people were telling us that the priest was telling them not to be tested, not to come to our events, not to use condoms and to take our brochures. Some principals at middle schools have specifically required us to provide 1 condom to each student because they were afraid they were going to use them. These kind of things. Some people have told us to, why are we doing this work if those people who are getting infected of HIV/AIDS deserve to die because they represent evil? So this is the kind of obstacles that we face more commonly. But I would say that we're partnering with the government, we're partnering with other institutions, and that has allowed us to do our work because we use diplomacy as one of our main resources to do our work. We don't really like to fight against the government or the other groups because we know our campaigns won't succeed without their help. So we're really clear that we need their help and they need our help, and that's how we approach and reach them out. Yes?
Does the Mexican government provide any funding for your program?
To Brazos Abiertos, no. As of now, no. Our funding comes from private donations. Since 2007, when the organization was formed, a U.S. donor gave us a building. Actually, he bought us a building, and he established a program. We established a program with that money, with that grant, and we do fundraisers, 2 fundraisers every year in the Yucatan, and both the expat community and the local community come, to our events. And starting next year, actually, we're going to apply for domestic funding. We found out that the government gives certain amount of grants for HIV/AIDS now, and we want to do that. We need people, we need more human resources to do all of this. But yes.
First of all, thank you for your talk. How has the reaction been with transgeneros, muchas, or tercera género populations in the Yucatan? Has there been any sort of collaborations with those folks?
Oh yes. Every time we do our late night testing from 8 p.m. to midnight, sometimes 1 to 2 a.m. in the morning at the Merida main square, we see a lot of transgender, transvestites, and also prostitutes. And they are very good and proactive in terms of inviting other people that are in the neighborhood, and young people, I mean, they convince them to come and be tested. We don't have a formal partnership with them or work specifically with that group because every time we do it, we welcome everybody. But in our experience, we have seen a lot of support from this.
In Mexico, there's a lot of small towns in which they have a lack of, getting condoms, getting information, education. A lot of small towns, my friends come from a small town that's like 5 hours away from the nearest hospital. Is Mexico, or are there programs that are outreaching to these smaller rural communities? What's going on with these
For
small
condoms?
towns all over Mexico?
Yes. In Mexico, there is a local health center in most of the rural communities. And even though there is, a bigger, like a county seat, and there is like a 500 inhabitant communities or 1,000, they should have an assigned physician with the health system. And each of those communities in the local health centers should have enough supplies of condoms. And sometimes people don't know they have it because the physicians or the nurses in charge of those facilities don't really spread the word or don't provide them. I mean, sometimes the condoms are sitting there for years and they expire. But if you have the opportunity to tell people, go to your local health center and ask for condoms because they should have plenty of condoms. And if they don't have it, make sure they file a report with their local jurisdiction or health district jurisdiction because they are sent thousands of condoms every month because the government requires a certain number of goals to meet every month. But then, what the nurses do is like, okay, I have to test 10 people for HIV. Well, it's one day before my deadline. Well, I test these people who came for their glucose testing. So they do it because they have to do it. It's just they're not really doing it because, people need it. So people need to be more empowered to ask for it, but they should have it.
Time for one more question.
You've already mentioned the language barrier, like with people that don't speak English or having to speak Spanish with a lot of patients. Do you find yourself having trouble accessing those who don't speak English or Spanish and speak like different Mayan dialects?
Yes, there are some communities in the Yucatan that only are Mayan speakers. And whenever we go to some of them, we try to bring with us a translator in Mayan. We haven't gone to many of those yet. But that's one of the projects we want to work in the future because there are only Mayan-speaking people in some villages, and that will be very interesting to do. In some of the villages where half of the villages speak Mayan and half Spanish, we have a translator. Yeah, but that's a really good point because also in the Yucatan, like Mexico, after the colonization, people were forced to speak Spanish and refused to speak their native languages too. And now the Mexican government is encouraging people to speak their language. They have middle schools that are focused in just indigenous languages, and they respect that. So I think bringing an HIV program component, speaking their own language, will benefit them a lot. One of the things I would like to work on next year is making a video in Mayan, so we'll reach them.
Can we thank Dr. Cabrera?